So I am Ray Fabius, and it's a distinct pleasure to have been invited and to participate on this wonderful panel. And as Fred said, it's not common for me as a physician to follow a global investment expert. So how wonderful it is just to have that juxtaposition. And I do want to also speak just for a minute about the plight of children. They're not as much of a market force. And as a pediatrician by background, I think we all need to focus on the next generation's capacity to make a difference early on, even with early childhood issues. But my focus today is around the value of investing in wellness and why population health and building cultures of health should be a corporate strategy. And I will focus in the limited time that I have in front of you on 5 issues. The value of investing in the health of a workforce will yield benefits due to medical cost reductions, productivity gains, increased employee engagement, being able to polish your brand and be an employer of choice. And then, as others have referred to, I will speak for a while about my research in connecting those companies that have been recognized for their health and safety efforts and their outperformance in the marketplace. I am particularly delighted to be the warm-up act for Ron Getzel, and actually a few of my slides are really his work. But during my tenure as the Chief Medical Officer for Truven Health Analytics, we actually did some research together that identified 8 companies who have actually trended downward in their healthcare costs. So the old goal when I was the global medical leader for General Electric was to try to see if you could make your healthcare costs go up at the same rate as general inflation. The new goal is to decrease your healthcare costs over time. The fact that there are 8 companies that are able to do this means that there's at least the potential of solving the healthcare crisis in this country one employer at a time. On the right-hand side, you can see research that Ron and those of us at Truven Health Analytics engaged in that actually studied the return of investment for building a culture of health at Johnson & Johnson. And as you can see, their medical cost trend was roughly flat all the way back in 2002 to 2008. And through a pretty comprehensive approach in terms of comparative analysis, this generated what appeared to be somewhere between a 2 and 4 to 1 return on investment when just considering health and pharmaceutical costs. This slide also speaks to a study that Ron did. This is with high-scoring companies in a self-assessment tool that's been developed by the HERO organization in Mercer. And so on the right, you can see actually as organizations self-assess and score higher in this survey, their medical trend goes down. And in my company, HealthNEXT, we have now identified, after studying these benchmark companies, 218 elements in 10 categories. And we can go into any company, score them out of 1,000 points, and identify their gaps from benchmark and help them to build a culture of health by scoring a score of around 700, which is what the benchmark companies appear to score. And in our early analysis, I'm sharing with you, and this is not yet published, but in our early analysis, there's a very tight association between medical trend and their score, their assessment as a culture of health organization. If we move on to issues of productivity gain, you can read textbooks in the human resource field, which basically say in order to train the next generation of human resource leadership, that all you need to do is get an organization of people with the skill and the will, and you can produce a great company. And that's the reason why we're asked to submit our CV to assess the skill, and then we are interviewed to assess the will. But what about not being ill? It is increasingly clear that if the workforce is skilled and willing but not well, you will not be able to create the competitive advantage that you're looking for. And what happens when people are not well? Well, first, they don't do their work well. Then they don't do their work on time. Then they're absent. And then they're lost to the workforce. And one of the quotes that I go around the country and say is based on the research that several of us have done, but has been featured by the Integrated Benefits Institute. This dramatic iceberg slide is so important because those employers in this country, anyway, that just focus on healthcare costs don't realize the true impact of poor health. Dear CEO, for every dollar you spend on healthcare, you lose $2 to $3 of productivity. This is an elegant study that was done by my colleague Bruce Sherman, which showed that there was a direct correlation between the cost of healthcare per worker at a manufacturing location and the degree of waste that that location engendered. And so as workforces are less healthy, they don't do their job as well, and there's impacts even on errors in a manufacturing location and the generation of excess waste. Many of us have talked about the issue of employee engagement, and this actually functions two ways. Those of us that are doctors often talk about engagement as patients who are engaged in their health. Those of us that are corporation leaders talk about engagement in terms of how loyal and how much discretionary effort an employee engages in. And so I speak to this issue as employee engagement squared. As you invest in the health of workers, they take better care of themselves and they are more engaged in their work. This elegant study done by Unilever was something that I showed my two sons when they were young. And of course they said, well, duh, Dad. I don't know why. We have to do studies to show that there is a direct correlation between the health of workers and their performance. But in this elegant study, it showed that those employees who were evaluated as top performers also scored much higher in health risk appraisals. And then, of course, when you express in a very special way to your employees that you care about their health, you create an employer of choice status. And so it is easier for your companies to fill positions, particularly in the global marketplace. And it's also quite clear that by engaging in a culture of health, you reduce the likelihood that people will leave your company for a small change in compensation, reducing turnover remarkably. This study, perhaps many of you are familiar with, that Towers Watson engaged in, where they looked at companies that they believed had the most effective health and productivity programs to show, among other things, an 18% difference in market premium. This one slide takes you through a personal journey that I've been on for the better part of, I'll say, 12 years. At one point in my career, I was the president of a company that provided the most workplace health centers in this country to about 100 large employers. Many of them were publicly traded, and it became clear to me that the clients in my company were doing better on the stock market than the indices would indicate, than the S&P 500 or the Dow Jones Industrials. And so I actually asked my financial team to pretend that my clients who were willing to invest in workplace health centers were a portfolio. How would they perform? And this was my first effort at trying to look at this issue. And this actually dates back to the 2005 to the 2008 period. And you can see in that red line remarkably better performance in a portfolio of companies that invested in workplace health centers. More recently, as Derek alluded to, my research that I did with the American College of Occupational Environmental Medicine showed that those employers who were recognized for their excellence in health and safety by winning the Corporate Health Achievement Award that the American College of Occupational Environmental Medicine gives each year outperform the indices as well. And then, most recently, I've been running a mutual fund that I'd love to talk to you about, Fred. It has one investor, me. And I've been running this fund since 2009. And I have been attempting, through the research from HealthNEXT and the literature, to invest in the top 30 or so companies that are the best corporate culture of health and safety companies that are known globally and that are publicly traded. And my portfolio, you can see at the bottom, has remarkably outperformed the indices. And in fact, over the last 5 years, it's outperformed the indices at roughly 4% per year for 5 years. When I showed this to the investment community, after a couple years, they said, that's cute. After 3 years, they said, you know, you might have something. And after 4 years, they said, get back to me if this trend continues. And at the end of 5 years now, we finally are getting the investment community's full attention. That's how long that takes. Okay. In the original study that we did with the American College of Occupational Environmental Medicine, we actually modeled this 4 different ways. And in all 4 ways, the panel of health and productivity, health and safety companies outperformed. While I'm going to say Ron and I and others are not at liberty yet to share with you the details of this, I wanted you to know that in January there will be 3 more articles published with further analysis and 9 additional models demonstrating this very high correlation between those companies that are interested in the health, safety, and wellness of their workforce and superior marketplace performance. And lastly, as others have spoken about already, we share this interest in trying to translate the importance of this information to the investment community. For any one of you who has a 401k or retirement plan who makes an investment, we believe that it's important for you to know about the health and illness burden of the workforce that you're investing in before you invest. This is a transparency that doesn't yet exist in the marketplace, and it needs to. And it needs to follow this concept of the sustainability index. Because, ladies and gentlemen, the issue is not just about a carbon footprint. It's also about the carbon-based life forms that make the services and produce the products. Thank you.